All right, welcome to our live session. I believe we are in week 5 already, if that's possible somehow. So tonight we are going to go over endocrine, nervous system, eye and ocular adnexa, auditory systems, and I'm also going to talk about the operating microscope. I believe we kind of talked about the operating microscope a few sessions ago, but it's just kind of one little code that we can touch on really quickly. So if you have any questions, just go ahead and add them to the chat. I have a little bit of a different tech setup. I have a new camera today. I'm going to be showing my book as well. So if you have your book, go ahead and take that out, and we're going to do just a lot of coding today like we did last week. Gosh, was that last week? Sorry, it's been a long day. Okay, I am going to share my screen and we'll get started. Should be sharing the right one. Please let me know if you guys have any problems viewing my screen. All right, so here we go. This is our week 5 live session. I'm just going to jump into it. So this week we are kind of at the tail end of the surgical systems section. So again, endocrine, eye, ocular adnexa, auditory systems, and then operating microscope. The endocrine system subsection is relatively small. If you go to the endocrine system subsection, and I'm not showing you my book. Hang on, let me change this. There we go. Let me know if that's backwards for you guys, or if that's correct. It always looks backwards for me, but I think it's okay for you. So let me know if my book looks backwards to you. But again, the endocrine systems, let me turn this off. There we go. That's a little bit better. Okay, good. Thank you. Endocrine system subsection is really small. So if you look, it starts on page 453. Actually, sorry, 452. I have my tab on 453, and it's really it's a page and a half. It's 2.5 pages here. So the endocrine system actually has glands throughout the body, right? So the endocrine system includes the pituitary, pineal glands, testicles, ovaries, pancreas, thyroid, thymus, and adrenal glands. So most of these glands are going to be in there, even though they're part of the endocrine system. Surgical procedures on these organs, if I can say that, or on these glands, are going to be located within like different sections, right? So the ovary procedures on the ovary, like removals of the ovary, that's going to be in the female genital system subsection. Testicles are going to be in the male genital system subsection, etc. So the only 4 glands in this actual endocrine system subsection of this book are the thyroid, parathyroid, adrenal, and thymus. And I want to say that there isn't even any procedures for one of them. So there's not a lot of stuff you can do to these glands. You can, if you look at the code starting on page 452, there are for thyroid glands specifically, there's only 3 different procedures that are types of categories of procedures that are included in this book. We have incision, excision, and removal, right? So essentially they can incise and drain assist, they can excise the thyroid, or they can remove a cyst on the thyroid. That's kind of it, right? So there's not a lot of stuff. Same thing with I hope this is not too small. On page 453, you've got parathyroid, thymus, adrenal glands, pancreas, and carotid body. So it's got 1, 2, 3, 4, 5, 6 different organs there. But I want to say that's it, right? There's no, yeah, I don't think you're not gonna have any procedures on the pancreas or yeah, I think it's the pancreas. So you have parathyroidectomies, you've got a thymectomy, adrenalectomy, carotid body tumor excision, and then an adrenalectomy here. So yeah, nothing on the pancreas. So it's a very small section. um, Let's see, common procedures, like I was just discussing. Here we have parathyroidectomies. So again, a lot of just removals, parathyroid autotransplantation add-on code. That's an add-on code. So look for that add-on symbol. The symbol for the add-on code obviously would be that plus code. So that's code 60512. Um, a lot of things that you can do on these glands is essentially remove them. Thymectomy, removal of the thymus, adrenalectomy, removal of the adrenal glands, and excision of a carotid body tumor. Not necessarily part of the endocrine system, but it is where it is, I guess. So yes, I'm going through this really quickly. So let's go through a practice scenario. We'll get through the endocrine system pretty quickly here. What's the CPT code for an adrenalectomy? We can go to the index, but if we just actually stay here on page 453, we can see there's, again, not a lot of codes to choose from. Try to make this a little bit bigger. Here we go. So you have excision procedures, right? An adrenalectomy is an excision. This is the parathyroid, thymectomy. And again, I'm on page 453. And I'm just kind of looking through here, right? 60540 is an adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar, or dorsal. So essentially, any kind of partial or complete adrenalectomy. 60545, notice that that's a child code. It's indented from that adrenalectomy parent code, and that would be an adrenalectomy with excision of adjacent retroperitoneal tumor. In this case, we're just looking for an adrenalectomy, so our code would be that 60540. So I kind of cheated there. That's because I know that these codes really are not anywhere else in the book, right? So long story short, when it comes to endocrine system section, endocrine system coding, if I said that right, it is in this very small section of the book. Let's do one more and then we'll move on. Excision of a carotid body tumor. That's actually in this exact same spot, directly under where we were looking. This is essentially the only area where you're going to find this procedure code, excision of a carotid body tumor. You can see it's on page 453. Down here, you have excision of carotid body tumor. This is code 60600. Excision of carotid body tumor without excision of carotid artery. 60605 is with excision of carotid artery. So yeah, your correct code is going to be 60600. So try not to say that this is a super, super easy section, but it's definitely one of the easier sections to code from in the CPT codebook. The nervous system. Oh, I guess I forgot about the nervous system. It is in there. Nervous system's a little bit more complicated. Okay, so the nervous system subsection, it starts on page 457. And this one requires a lot more knowledge, I think, of human anatomy in terms of the nervous system itself, right? You can see on the screen there's two primary divisions of the nervous system. There is the peripheral nervous system and the central nervous system. So the table of contents on page 455, you can see this subsection of the CPT codebook is divided essentially in these two divisions, right? So you have skull, meninges, and brain. So even though it might not necessarily be part of the nervous system, meaning you're not doing anything to a nerve per se, the skull, meninges, and brain includes surgical procedures that are going to impact the central nervous system, for lack of a better way to put that, right? So you've got implantation of neurostimulators, a cerebrospinal fluid shunt, that's a pretty common procedure, surgery of the skull base, craniotomy, craniectomies. So those are going to be surgical procedures on the skull itself. They're not located in the musculoskeletal system subsection. They're located here in this nervous system. So besides that, right, the other two divisions of the nervous system, sorry, I'm always a little bit off here, are the spine and spinal cord. That's going to be the central nervous system. So the central nervous system, as you can see on our little picture, that's got the brain itself, and then the spine, and then the spinal cord going down, right? If you flip the page, we do have a nice little anatomical diagram here. You've got I don't know names of nerves at all, right? I know some of these, I think. Maybe not really. So this on page 456 is a nice little diagram of nerves, and nerve names if you need that. And then here on page 457, you have the table of contents for the peripheral nervous system. The peripheral nervous system is all of the rest of the nerves that go throughout all of the rest of the body. So there's a number of different procedures that they can perform on these. You've got like injections of anesthetic agents. Those are going to be nerve blocks, diagnostic or therapeutic. So sometimes a nerve block is done to kind of see what it impacts. That would be a diagnostic procedure. Therapeutic procedure would be an injection of a nerve block for a therapeutic reason, probably for relief of pain. And those are going to be the codes are divided based off of the nerves themselves. Implantation of neurostimulators. Another common one is distraction by neurolytic agent. So they can actually destroy nerves. A lot of times, again, that's done for a lot of reasons. That's called chemodenervation, kind of a cool word, I think, because they are denervating something via the use of a chemical. And again, you're going to identify the nerves involved there. Neuroplastics, so plastic procedures on the nerves, excisions, repairs, all that kind of fun stuff. What else is going on? You also have a nice little anatomical diagram here of brain anatomy, and then this section of the brain and the brain stem. Again, this is not my strong suit in terms of brain or anatomy or even nerve anatomy, but I don't think it's not going to be a hindrance as long as you just follow your index, follow your coding guidelines. Other things that are going to be important when you're coding from the nervous system is going to be to know the difference between vertebral bodies and interspaces. I want to say, hang on, let me flip. I want to say we have some diagrams here, but yeah, see, there's that one. I might be thinking of, yeah, there's a few different anatomical diagrams. So there are a number of different anatomical diagrams, but it is important to understand that there are spaces. Move this guy. Here we go. So like this lumbar laminectomy, and I just flipped over to page 474 here. Here you can kind of see the difference. So here we have two vertebrae, right? And this is the fifth lumbar vertebrae. And then we have this lumbar would go down. I'm not sure what the number of this vertebrae. I'm not going to like just misquote it here. The spinal cord goes through there, and then you have those nerve roots. So you have two different vertebrae involved here. Yeah, we're not talking about differences. So if you have a problem, or I think if you need more in terms of, what am I trying to say? Anatomy regarding or on vertebra and vertebral interspaces. Look at the anatomical diagrams in the musculoskeletal system subsection. Sorry, lots of big words tonight. But I guess what I'm trying to say here is just know the difference between the vertebral bodies themselves and the interspaces. So are you performing the procedure on the actual bone, the vertebral body, or are you performing that procedure on the interspaces in between the vertebrae, right? And so like you can see, I'm just going to flip over here to page 645. And I'm on code 63030. I'm sorry, 63020. I'll go to the parent code there. That's a laminotomy with decompression of nerve roots, including partial facetectomy. Oh gosh, how do I say this? Facetectomy. It's a facet joint, so it's a facetectomy. That's a removal of actually part of the bone. A foraminotomy and or excision of herniated intervertebral discs, and that's for one interspace in the cervical location of the spine. One interspace meaning that area in between the vertebra. Right, and then let's see, so if it was for bilateral procedure, oh yes, always remember that the vertebrae are bilateral, so always check for that if it's bilateral or unilateral. Each attention. Okay. And then so you have down here 63035. And I know I'm kind of just all over the place right now, but I'm just giving you an example. 63035 is an add-on code that you would use for each additional interspace, cervical or lumbar. Right. So again, what you're going to find here is procedures on interspaces. That again is the areas between the vertebrae. Sorry, I went off on a little tangent there. Anatomy is important. Skull anatomy is important. There are some anatomical diagrams like what we were just looking at. So this is kind of just basic skull anatomy, spine and vertebrae. Again, just know the difference between, so there is a intervertebral disc is the disc in between the vertebrae themselves. The vertebrae are, if you look at this top view of the vertebrae, they are considered bilateral structures. So sometimes we can do a procedure on only like the right side or the left side. So many of those procedures are going to be identified as unilateral. So if it is performed on one side of the body or the spine, you're going to use the RT and LT modifiers. Other things that are important are the areas of the spine here: cervical, thoracic, lumbar, sacrum, coccyx. Most of the procedures are going to identify the specific area of the spine, kind of like what we were just looking at, like cervical or lumbar. If you look at some of these other ones, we've got, oh yeah, cervical, thoracic, lumbar. So that area is important. All right. Let's do some practice. Here we have a supratentorial exploratory craniotomy. So let's look this one up. We're not going to cheat this time. Let's go to our index. Okay, so in our index, we have to, and I'll walk us through this one, supratentorial exploratory craniotomy. So in this case, what is our definitive procedure? It's not supratentorial, that's an area. Exploratory is kind of like the purpose of the procedure. And so the actual main term that we're looking up is going to be a craniotomy. So let's look that up. OPQR. Craniotomy. Okay, we are on page 1143. I'm over here on the left-hand column, kind of in the middle. Craniotomy, lots of different types of craniotomies. So here on the screen it says supratentorial exploratory. So let's see what we have. Craniotomy, anesthesia by frontal bone flap, decompression drainage, exploratory. Okay, yeah, so here we don't have the area listed in the index, but we do have the intent here, this exploratory term. So craniotomy, exploratory, we have two options, 61304 and 61305. So let's go see which one is right. Okay, craniectomy or craniotomy. Here we are. This is on page 458, 61304 and 61305 on page 458. We have 61304 is craniectomy or craniotomy exploratory, supratentorial. 61305 is infratentorial posterior fossa. So in this case, yes, those of you on the answering on the chat are correct. 61304. Kind of scary words here, but it's not as hard to look up, I think, as it might have seemed. Okay, let's go ahead and do one more. Here we go. This one might be a little bit more difficult. I'm gonna have you guys do this one. I'm gonna give you like maybe a minute, 60 seconds. What as I talk. So if I'm bothering you, I'll shut up here in a second. What is the CPT code for the injection of botulinum toxin for migraines? Hint. Oh, sorry. 7 separate injections into the facial and cervical muscles bilaterally. So here, this is that what I was just talking about in terms of destruction by neurolytic agent, i.e. chemodenervation. So that's the term that you're going to look up in the index is chemodenervation. Once you get there, it will identify which nerve you chemodenervated. If you need help in the index, you're going to find chemodenervation on page 1132. So in that bottom right-hand corner, what are we chemodenervating here? What are we injecting? Facial and cervical muscles. So we have some for facial muscles, some for neck muscle. Neck, cervical area is that neck area, right? That's going to lead us to 64612, 64615, 64616. All right, I see one answer in the chat. I'm finding these codes on page 491. They're up at the top right-hand corner. All right, good job. All right, I think I got all of you guys. Okay, good. Great job. Yes, your answer is correct. 64615. Okay, so why is this the correct answer? You can see 64612 is a chemodenervation innervated by the facial nerve, just facial nerve. On our scenario here, we have facial and cervical. So 64615 is muscles innervated by facial, trigeminal, cervical, spinal, and accessory nerves, bilateral. 64616 is just nerves. So 64615 includes both the face and the cervical muscles, and it is bilateral. I like this one because this is actually this is Botox, botulinum toxin. It's interesting kind of talk. You hear a lot about Botox is used for cosmetic purposes, but Botox is actually used very often for therapeutic purposes, for chemodenervation scenarios, right? So in this one, it's really, really common, Botox for migraines. They inject it in a number of different places, kind of in the face and in the cervical nerves and other nerves that are going to impact patients with migraines. Botox is also used, it's used in a lot of different areas across the body, basically, to kind of, I'm not sure what's the right term, right? So chemodenervate. So it like temporarily paralyzes that nerve that can cause pain. It's used in the axillary region for patients with hydra. Oh gosh, I just went blank. It's where they have excessive sweating in their armpits, essentially. They can get injections in their armpits, and Botox helps with that. So Botox it's pretty common. This is a pretty common scenario. We see it a lot in the ED and emergency department. Sometimes we'll see it in primary care, definitely in neurology practices. Okay, moving on. Let's talk about eye and ocular adnexa coding. So these are actually two different sections, subsections, I should say, of the CPT code book. You've got the eye section first. And this is eye and ocular adnexa, and it starts on page 497. And then we have the ear. So the tab says oc/odd, so that would be ocular/auditory. So there's one tab, but it's actually for two sections. The eyeball. So when we talk about procedures on the eyeball, or on the eye and ocular adnexa, anatomy is important. I went to an eye doctor once when I was living in Texas, and this guy told me that the eye is the most complex organ in the human body. And I don't know if he is right or not, but it surely is complex, right? So eye anatomy is extremely important when you're talking about procedures, ophthalmological procedures, eye and ocular adnexa. So the first little section of procedures we have is on the eyeball itself. That's like on the entire structure, right? So you're going to have procedures like removal of the eye, or enucleation of the eyeball. Essentially, there's a couple of different procedures. You've got evisceration of the ocular contents, where they can like take out the insides of the eyeball with leaving the eyeball in there. Sometimes they will or will not implant something in there. Enucleation of the eye. And then there's exenteration of the orbit, which is essentially removal of the whole thing. They can go all the way down and remove the bone and muscle flaps and stuff, right? So those are procedures on the eyeball itself. There's also some implant procedures. Probably more common, though, you've got procedures for removal of foreign body and repair of lacerations on the eyeball itself. The next section you're going to have is the anterior segment. That's going to be, let me see if there's a picture here. I thought there was a picture. Yes, there is. If we go to page 500 in the CPT code book, you can get kind of a zoomed in picture here of the anterior segment of the eye. So if you're looking at that picture on page 500, or if you're looking at my screen here, the anterior segment is essentially like the front segment of the eyeball. It has the anterior segment. It includes the cornea, the iris, the aqueous, which is essentially kind of like the liquid kind of in all of this area. It includes the lens, it includes the anterior chamber and the posterior chamber. So lots of complex stuff here. The ciliary body and the trabecular meshwork. The trabecular meshwork is the area that they work on when they perform glaucoma surgery, I believe. So anyways, you have lots of procedures on that anterior segment. The cornea is a big one. Corneal transplantations or implantations. You have keratoplasty. I don't know how you say it, but that's a corneal transplant. Lots of different corneal transplant procedures. I heard once that when you talk about organ transplants, cornea transplants are the most common organ transplant. I don't know if that's still true or not, but I heard that once. So take that if you will. Let's see, other stuff we're doing. Removals, anterior sclera. Yeah, lots of stuff. So very complex. Glaucoma surgeries. I don't know. Eye procedures always kind of wig me out a little bit. You also have lens procedures. So these procedures are going to be performed for excuse me, let me say that differently. Lens procedures are typically going to be performed for cataract removal. So when you see this intraocular lens procedure category, this is on page 505. You've got extracapsular, I'm just going to like pick one, 66982, extracapsular cataract removal, right? So cataracts are extremely common in people. I believe they start typically on ages 65 and over. It's where this little lens just starts to get cloudy. and they can take it out, right? They take that lens out, they can replace it. You can actually replace it now with something called a toric lens, I believe is what it's called. Insurance doesn't typically pay for it, but it's essentially like having your glasses directly in your eyeball, right? So like if you needed correction, if you needed eyeglasses for correction, they can replace your lens with a toric lens, which will correct your eyesight. So I don't know if you guys have ever seen people with cataract, who have had cataract surgery, in older people or anyone with a cataract correction. If you look at them in the eyeballs, sometimes you'll see kind of like a reflection in their eyeballs. That's because they have that lens in there. What else? Oh, retinal detach. Oh, no, that's posterior. Okay. Yep. Moving on to the posterior segment. This one is pretty interesting. I don't know if we really have, I guess posterior segment would be anything after that posterior chamber, right? You have your anterior chamber, that's where your cornea is. Your posterior chamber, that's where your lens is. Everything kind of after that is going to be the posterior segment of the eyeball. So be careful with your terminology here, right? Posterior chamber is different than the posterior segment. Here we're going to have your vitreous chamber, which includes all your vitreous jelly, your retina. Common procedures here, you've got repair of retinal detachments. You've also got, and I'm flipping, I'm on page 508, 509, you've got strabismus surgeries. I always thought this was pretty cool because you've got like, it literally got, they reposition the muscles that are attached to the eyes to realign them, if necessary, right? So if you have patients with strabismus, right, where one eye looks one direction, the other eye looks a different direction, they can go in there and actually realign those muscles. I had a student once forever ago who had actually had this done. So pretty interesting stuff. Um, Posterior set. That's the ocular adnexa. Look, I'm getting ahead of myself. That is in the ocular adnexa because that's the extraocular muscles there. And then the conjunctiva. Okay, so let me stop right there. The ocular adnexa, that does start, that's where that strabismus surgery is. That starts on page 508. What else is included within the ocular adnexa? That's just kind of all the rest of the accessory structures, right? So you've got the muscles, you got the orbit. Essentially, the orbit's kind of just that area where the eyeball rests. The eyelids themselves. When we're talking about eyelid procedures, pay attention to laterality and upper or lower eyelid, if that makes sense, right? So let's look at that first code on page 511. So in the eyelid section, you have 67700, blepharotomy, drainage of abscess of the eyelid. Okay, cool, right? Let's say you did this on the right upper eyelid. How are you going to identify that particular eyelid? Does anybody on the call know how we are going to identify the right upper eyelid specifically? Modifier? Okay. Okay. Good stuff. All right. You guys are all right, right? RT. Okay. So yes, we have a modifier. It's not going to be RT because RT just identifies right. So you're going to use an E modifier, E for eyelid, right? If you go to Appendix A, go to the very back of Appendix A. Appendix A is our list of modifiers, right? At the very end of Appendix A on page 975, you have a selection of HCPCS modifiers, and you have the first ones here are going to be your eyelid modifiers. So if I said upper right, Teresa, you're right. E3 is our upper right eyelid, E3. E1 is upper left, E2 is lower left, E3 upper right, E4 lower right. So don't forget that these are here. These are important when it comes to eyelids. In the real world, some payers can be kind of picky about these eyelid modifiers, and Sometimes a payer will want an RT modifier rather than the E3 modifier, but if we want to talk about, specific how we code it, you should use E3. Next, what do we got? Conjunctiva. The conjunctiva is its own little section here, right? So this is kind of just the film, I guess, right? I don't want to say film because it's more than that. On the outside of the eye, incision and drainage, excision, biopsies. You do have procedures here on the lacrimal system. I think we have some pictures. Oh yeah. On page 514. The lacrimal system is essentially your tear ducts, right? And so crazy to think that they can do these procedures. So like this one on the left-hand side on page 514, it's closure of lacrimal punctum by plug. So if you look in the mirror, right, if you look really close, you see that little teeny tiny hole in your tear duct, right? Right there, right? And if it's essentially for patients with chronic dry eye syndrome, they can go in there and put a little plug in there so that it doesn't drain so much, which is absolutely nuts, I think. Same thing for probing of nasolacrimal duct. And then I think that they can also dilation. They can also dilate it. I actually had a friend once who had a son with lacrimal ductal stenosis, where essentially his lacrimal duct was super, super small, and he used to always get these goopy eyes because it was the opposite of dry eye. His eyes wouldn't drain, right? And he would get these goopy eyes when he was a kid. And so one of the ways they can fix that is by dilating the lacrimal duct, the lacrimal punctum. What else? Okay, so that is the long and short of eye and ocular nexa. Let's do some practice. Biopsy of the conjunctiva. Let me see if we want to do something different. Yeah, I think we have time. Let's do this one. So let's go ahead and do biopsy. I actually just saw this code, so let's go to the index. I'll give you guys. Oh, look, Teresa, you are on the ball, girl. Okay, so I'm gonna give you guys like, I don't know, 30 seconds or so. What is the code for biopsy of the conjunctiva? And I'm not gonna talk us through it. Right? Correct. Good job. 68100. Biopsy of conjunctiva. That one wasn't too bad. Let's do this one. CPT code for closure of lacrimal punctum by laser surgery. So we're going to be in that lacrimal system again. I'm going to give you guys 30 seconds to 60 seconds, see what you come up with. And I'm not going to talk. All right, you guys are fast. Right, correct. 68760. That is actually on the same page here. It's on page 513. The closure of the lacrimal punctum by thermocauterization, ligation, or laser surgery. So that's your code. Good job. Next, let's talk about the auditory system. All right. Starts on page 515. The auditory system is kind of like the eye in terms of our divisions here. We're going from the front to the middle or to the back, I guess. So divisions in the auditory system. Here you have the external auditory system. That includes the helix. The auricle is like the whole ear, which you would consider the ear. The helix is that part up at the top curve. Then you have the tragus, which is kind of that seashell going on the end, going to the end, and then the lobule, which is the bottom part of the ear itself. Um, as far as procedures on the external ear, there's really not a lot. It's a relatively small section. You have drainage of abscesses, biopsies, excision of soft tissue lesions, removal of foreign bodies. There are, oh, these are super important codes. I don't know why these are external, because I always want to think that these are middle ear, but I guess part of that external ear is the tube, right? That this is the external area. So if we talk about otitis being ear infection, right? An otitis, a typical ear infection is called OM, otitis media. That's because it's an infection of the middle ear, right? Meaning it's essentially behind the eardrum, right? It's kind of like backflow of boogers to a certain, for lack of a better term, up the eustachian tube. And then it kind of pushes on that tympanic membrane. That's why it's so painful, especially for kiddos, right? And that's why kiddos get it more often than adults because their little eustachian tubes are smaller. Okay, so that's an otitis media. That's in the middle ear. You can also have otitis externa, which is usually what we call swimmer's ear. If you've ever had, or if you have kids who swim a lot, especially in the summertime, they'll get an inflammation of the external ear canal. It's still on the inside of the ear based off of what we can see, right? But it's before the eardrum. And that's like otitis externa. That's when typically you can just kind of heal it with eardrops. So another thing that happens very, very commonly in this canal, this external auditory canal, is we get earwax, right? Earwax builds up and it hardens, and we get earwax. The word for earwax is cerumen, 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 and it gets hardened, and it can be itchy, painful, block hearing, lots of problems, right? So it's really, really common that patients come in, both kids and adults, it happens to everybody. They come in and they have what's called impacted cerumen. And so you may have had this happen to you, or maybe your kiddos, right? Where you have to take them to the doctor or go to the doctor and get your earwax removed, right? Removal of impacted cerumen. So there's two different ways they can do it. There's, and I'm on page 516. And this will just be good for you guys to know for the real world, because again, this is really common procedures. On page 516, 69209 is removal of impacted cerumen using irrigation or lavage unilateral. And so these are per ear unilaterally, because you don't have impacted cerumen bilaterally. You can, right? But it's not always. So the codes are unilateral, either right or left, right? So use your RT-LT modifiers. Now this one, 69209, is irrigation or lavage. This is done typically when the medical assistant will, they do it a couple of different ways. Excuse me, they'll squirt in a little squirty tube, right? And then let it kind of drip out. That's going to be irrigation or lavage. Sometimes they'll have the patient come in and say, yeah, it's pretty hard, but then they have the patient go home and use eardrops for a week or a couple of days, and then they come in and then they do the lavage and get that earwax out. That's irrigation or lavage. If, on the other hand, the provider has to do it, the physician has to do it using instrumentation, we're going to use CPT code 69210. That's removal of impacted cerumen requiring instrumentation. Again, unilateral. Instrumentation, if you've ever seen these little things, they're the cutest, weirdest little teeny tiny spoons. And the doctor literally goes in there with their little spoon and like scoops it out. Sometimes it's a spoon, sometimes it's like a little a wire, not a wire, but it's just like a round kind of lasso looking thing to kind of scoop that out. So lots of guidelines, lots of different in the real world payer differences on how payers may or may not pay for this code or these codes. But again, really important codes, because pretty much everybody does these. If you work in pediatrics or adult primary care, family practice, you're going to see these codes for sure. Okay, I feel like I'm just talking a lot about different stuff today. Hopefully this is interesting. um, the next, sorry, going into, again, the auditory system, the next section we have is the middle ear. So the middle ear starts at that tympanic membrane and it goes kind of down. I don't know if we have procedures on the eustachian tube. I don't think there are a lot of procedures on the eustachian tube in this section, but here you're definitely going to have procedures on the eardrum or your tympanic membrane. A lot of times docs will just call it your TM, tympanic membrane. Really common procedure is ear tubes. So like I was saying, as far as ear infections go, otitis media, you get these boogies that come up and they push on that eardrum, right? And it can be very painful. So if we insert a little tube here, so if you ever hear, or if you've had your kids have had ear tubes, it's essentially exactly what it is. It's a teeny tiny tube, and you can see a picture of it here on page 517 that they put directly in the eardrum. It stays in the eardrum, and it just drains out when that kiddo does get an ear infection, or when they do get that liquid backup, right? It drains out. So instead of being painful, it has like an outlet, right? Eventually, those ear tubes will just fall out once the kiddo gets a little older. Sometimes they'll have to redo it. Sometimes the once is good enough. So here is the really common procedure. It's called a tympanostomy. That's where they put in that little tube in the eardrum. Ventilating tube is inserted in the opening of the tympanum. It looks like our code range is 69433. Tympanostomy through 69436. Local or topical anesthesia, general anesthesia. So that would be if that patient is put under just local or topical anesthesia, or if we had to put them under general anesthesia. Those are going to be those two really common codes. And not really common, but obviously if you work in ENT, they're going to be pretty common. You've got some other, there's tympanoplasty. That's on page 518. You have a picture of that. That's if they actually do a graft to repair that eardrum. Okay, let's talk about the inner ear. So the inner ear includes all of this fun stuff, right? So you've got your cochlea, vestibulocochlear nerve, oval window, round window, vestibular apparatus. There's not a ton of things, not a ton of procedures in this section, but probably one of the more common ones is going to be a cochlear device. That's going to be on page 520. That's an internal device to essentially help hearing. It stimulates the cochlear nerve. It's pretty interesting, right? So like this goes into the patient. I think it goes actually like in the bone, I can't remember the name of it, the bone behind the ear goes directly into the cochlea, and then the patient will wear that little receiver on the back. Oh, that's an internal receiver. I don't know, they might have it different now, right? But you can sometimes see patients will have like a little receiver on the back of their head. That's for that cochlear device. The temporal bone, that's what it's called. Temporal bone. There you go. Okay. Total facial, yeah. Okay. Other things we have, oh wait, we're gonna do some practice and then we're gonna talk about the operating microscope very quickly. Let's look at this one, decompression of internal auditory canal. I'm gonna let you guys find this one. Oh, how funny, it's right there. When you have these really much smaller sections, it's easier to find the codes, that's for sure. So I'm gonna let you guys find that. I'm gonna stop talking for like 30 seconds. Yep, you guys are right. You guys are fast. 69960. These ones aren't exceptionally difficult, I think. 69960 is right there on page 520. Decompression of internal auditory canal. Let's do one more and then we'll move on. Tympanic neurectomy. That one might be a little bit more difficult to find. So I'm going to stop talking and let you guys find the code for a tympanic neurectomy. All right, great job. 69676. Essentially exactly what it says. It's on page 519, tympanic neurectomy. The only thing I would like to, I guess I should point out here is that just make sure you pay attention to, again, laterality. Ears are bilateral, right? You have right ear, left ear. And so for bilateral procedures, you're going to want to report modifier 50 if you do that procedure on both ears. If not, you're going to want to really make sure you use your RT and LT modifiers. And in the real world, you also want to make sure that your diagnosis codes match the procedure code, right? So like if you have a diagnosis code for otitis media of the right ear, or rather I should say impacted cerumen of the right ear, you're going to want to make sure that you have your CPT code 69210. Did I say that code right? 69210 with the modifier RT, right? Because if you use a modifier LT with a right-sided diagnosis code, that payer is going to deny your claim, right? Because they don't match up. So important tidbit for real world coding. Okay, let's look at this guy. I want to say I talked about the operating microscope in a live session a few weeks ago, so I'm just going to go over this really pretty quickly. There's just one code. It's on page 520. It's technically its own subsection of the surgery section. This is our operating microscope. CPT code is 69990. This is a cool picture of what an operating microscope looks like. So you can see this would be like suspended over a patient. The surgeon would be looking through the microscope and performing the procedure. It is an add-on code. So when an operating microscope is used to facilitate a procedure, you should report the operating microscope add-on code, right? However, many codes have the use of the operating microscope built into the code description. So when that's the case, it would be double billing, right, to report operating microscope as well as a procedure that already reports operating microscope, right? So I'm going to make this a little bit bigger here. Pay attention to your parenthetical guidelines here and just pay attention to your notes. The surgical, I'm not going to read through this whole thing. Do not report 69990 in addition to procedures where the use of the operating microscope is an inclusive component. And then it gives you a big old list of codes here. So just make sure that if you are coding or if your documentation does state that operating microscope was used, and you want to use 69990, make sure that the code for your primary procedure is not included in this list, right? Because then if you report both of those, then it's going to be overbilling, essentially, right? I think that's it. Okay, well, that in a nutshell is eye, ocular adnexa, endocrine nervous system, and operating microscope coding. I know these ones weren't extremely complicated, but it's a lot to kind of get through, I think. What else? I'm going to stop right there. Do you guys have any questions, concerns about these sections? Nope. All right. All righty. Well, thank you guys for joining us this evening. I'm going to stop sharing my screen. Reach out to me, please, if you need anything throughout the week, and happy coding. Have a great week 5.